We don't have a truly objective test like an image or a blood test that says, yes, this is a sports concussion. We set out to see if we could use blood biomarkers to help us diagnose or predict severity in sports concussion. A sports concussion is probably different than some of the other brain injuries that are a little more advanced in marker science. So there was some FDA approval earlier this year for a brain trauma index that tells you if someone has a brain bleed or a bigger structural injury inside the brain, which isn't sports-related concussion. So we looked at some of those same compounds and other ones, and we're trying to figure out, do they also change after a brain injury or after a sports concussion? Our study's biggest finding is establishing normal levels for these markers in college-aged athletes. I think this is one of the first studies to have this large of a baseline group, so over 400 athletes in the college age. So hopefully that will help us go further and determine what is abnormal. A part of our study did focus on athletes who had concussion, and we had between 29 and 36 different athletes where we had blood samples after a concussion. So we did look at the markers for those athletes, and we found that there are some elevations in some of the markers that we could say were statistically significant from their baseline. Another finding in our study was that the number of concussions that an athlete had in the past, so before we took this baseline sample, and their number of years playing collision sports, did not affect the level of biomarker at baseline. So that's important because there's a lot of thought or thinking that if you have early exposure to contact sports or you've had a lot of concussions in your life, that it may have some consequence. So at least from these tests, we're not seeing a physiologic difference at this age from numbers of concussions sustained or numbers of years playing collision sports. Biomarkers may hold promise in combination with our clinical testing that we currently do for concussion. I think our study is a first step to getting toward improved accuracy on ruling out the condition, and then also diagnosing the condition in situations where it's hard to figure out.